आप सुन रहे हैं EBC रेडियो WWTR 1170 AM ब्रिज वाटर, आपकी चॉइस।
EBC Radio, आपकी चॉइस, 1170 AM.
Good afternoon, friends. A very warm welcome on EBC Radio 1170 AM, Aapki Choice. And this is the show called Health Education Series, brought to you by RWJBarnabas Health. And in this show, we bring you so many different doctors to educate you on different aspects of health that matters to you. Today, we are going to be talking on shoulder injuries. And to talk on that topic, we have Dr. Amish Naik, and we will be talking about so many different things, how to, keep your shoulders, strong and healthy. So I want to say a little bit about who is Dr. Amish Naik. Dr. Amish Naik, an orthopedic surgeon with RWJBarnabas Health Medical Group, who is on staff at Clara Mass Medical Center, Cooper Men Barnabas Medical Center, and Jersey City Medical Center. Dr. Naik specializes in the treatment of the hand and upper extremities. He obtained his medical degree from the University of Rochester and completed his training at the Cleveland Clinical Foundation, Beth Israel Medical Center, and New York University Medical Center. With that, Dr. Amish Naik, a very warm welcome on EBC Radio. How are you doing?
Oh, thank you for having me. I'm doing great.
Fantastic. And it's a privilege and honor to be talking to you today on EBC Radio. And I'm really honored to learn a lot from you and our listeners to get educated about shoulder injuries.
Oh, thank you. Thank you for having me.
So, doctor, tell me, the focus of today's show is shoulder injuries. So, now let's start by explaining the components of shoulder joint and how it works.
Yeah, so the shoulder joint is a very interesting joint. It accounts for many of the complaints that general orthopedic surgeons see in their practice every day. It's a ball and socket joint. So you have your humerus bone, which is on the arm, and it connects with the socket, which is on the shoulder part of the body. And around the joint, there's multiple tendons and ligaments that contribute to the complex motion of the shoulder. The normal functioning shoulder has a very wide arc of motion, and there's many components to it, and oftentimes with injuries, the shoulder is very prone to these injuries because even one of the components, either the muscles, the tendons, or the bone, can get injured or degrade over time, and then people will have pain.
Okay. So can you give us an overview of the most common types of shoulder injuries?
Well, that really depends on the person's age. So when we're younger, you oftentimes will get injuries such as dislocations of the shoulder. You have a fall, and, the shoulder pops out of its socket, and then you go to the emergency room and they put it back in. Oftentimes, in younger people, sometimes you'll get fractures around the shoulder. As we get older, particularly, past the age of 65, as our bone density changes a little bit, and we get osteopenia or osteoporosis. Even small falls or injuries can result in fractures of the shoulder. But the good news is that most shoulder fractures and injuries injuries to the tendon, like rotator cuff tears, they can all be treated without any need for surgery in people above the age of 65. For the vast majority of people. But usually when you get above the age of 65, it's usually falls or other low energy injuries that can cause bone breaks and tendon injuries.
And that's when they should go to the emergency and get checked.
Yeah. And sometimes a lot of people will have pain, particularly at night. When they're sleeping, they wake up in the middle of the night and their shoulder hurts. Oftentimes that's due to an injury to the tendons around the shoulder called the rotator cuff. And you see that very commonly in people above the age of 65. When you get to around your 70s, 80s, up to 30 to 50% of people will have a tear of the rotator cuff. But the good news is most people, when they have small tears, they don't feel it and doesn't impede their activity. But sometimes when they get bigger and they're associated with things like arthritis, sometimes it can cause pain.
So, doctor, like I know these pains, everybody has a tolerance. And often when you get these pains, you intend to tolerate until, as you said, like in the nighttime, you're sleeping and suddenly you feel the pain. So what are the warning signs of a shoulder injury?
Well, pain that persists more than a couple of days. If you have pain and it wakes you up in the middle of the night and, it's disturbing your sleep, or, you've tried the usual things like putting ice on your shoulder or using Advil or Tylenol, and you're still having pain persistently beyond a few days, then you should really see somebody about that. No one should have to live in pain. So certainly you should definitely see a doctor about it.
Right. It's just like, a personal question, like say often people try to work out or they lift something heavy or they overdo something which they don't realize, and they lift heavy stuff or something like that, and they pull some muscles, or maybe they feel little pain, and so they might have hurt their shoulder or some part of the shoulder, and they don't realize, and they give an excuse that, oh, maybe I did this too much yesterday or today, and maybe that's making the pain go. So how do they take care of that?
Yeah, so, my usual recommendations, if you have minor aches and pains in the shoulder, and this is, pain that only lasts for a day or two, and it's associated with a particular activity, I recommend using ice or heat. Ice after you do a workout or an activity, heat beforehand, if you're going to do a workout or go to the gym, you should definitely, and if you have prior problems with your shoulder, you should definitely put a little bit of a heating pack on your shoulder so it warms everything up. Afterwards, you can put a little ice on it, and a little Advil also goes a long way if you're able to tolerate that. But, like I said, if you're getting pain that just persists beyond a couple of days, and it's waking you up at night and it's interfering, you should definitely get it checked out.
Okay. So who is most at risk of a shoulder injury?
Who's the most at risk? It's usually people above the age of 65. In my practice, I would say the majority of people that I see for shoulder problems are above the age of 50 for sure, and definitely there's a very large population above 65. Particularly because, as we get older, our bone density decreases, and then you fall, and then you can get like minor fractures, you can get a tear, And certainly, another reason you should see a doctor is that if you have a fall, for instance, and you're not able to move your shoulder normally, like if you're not able to raise, yesterday you were able to raise your arm above your shoulder level, and then today you're not able to do that. That's something that needs to be evaluated. If it's just pain when you do that, minor pain that seems to be getting better, you can, try ice and anti-inflammatory for a day or two. But if you're having real difficulty with function of the shoulder, then that's something you shouldn't ignore.
So shoulder is like a complete part of your whole hand? Does it affect like you're from fingers to the shoulder, or shoulder by itself, it's one of the component?
Yeah, I mean, you can have a shoulder injury and feel it running all the way down the arm. Especially when you have, any kind of injury or, a tear, you sometimes don't even feel it right at the shoulder joint. You feel it going down the arm, on the side of your arm or in the front of your arm, and it tends to travel down the arm a little bit. So it can affect the entire arm, and, sometimes people will, feel feel it going all the way down to their elbow, and they think that there's something going on with the elbow, but it's actually coming from the shoulder.
So, doctor, when somebody feels this kind of pain, so which doctor they should go and see? Should they come and see like orthopedic, or they should go and see the general physician?
So it's always good to go see your general practitioner. A lot of insurance plans out there, they require a referral from your primary care doctor.
Mm-hmm.
So it's always good to start off with your primary care doctor. You can, go directly to the orthopedic surgeon.
Mm-hmm.
And there's no harm in just going directly to an orthopedic surgeon. If you have a shoulder and elbow problem, most, or general orthopedic surgeons should be able to handle it. And, if you need to see a specialist like myself,
mm-hmm.
They can certainly refer you, or you can make a direct appointment.
Okay, good. So now, what are the treatment options for shoulder injuries, doctor?
Well, it's a very wide variety of treatment options, but the vast majority, I would say, are all non-operative. Usually, for most people, the vast majority of shoulder injuries, whether it's a tendon injury or even a fracture, usually you have some period of immobilization where you're in a sling, and then we get you into physical therapy to start gradually moving your shoulder so that you're able to get back to the activity level that you're used to. Now, in some cases, some people need surgery, or some people need steroid injections to help with the pain and inflammation. But usually, it's usually depending on what it is, it could it's most of the time non-operative, and then in some cases, some people do need surgery.
Okay, friends, we are talking to Dr. Amish Naik, and he is an orthopedic surgeon. So we are here to talk on shoulder injuries topic today. So I hope you are benefiting from the information what doctor is telling us. So let's hear him more and see, when is surgery needed, doctor?
So, surgery is needed for a lot of reasons. The most common reason why people need surgery is that you've tried, a whole host of conservative treatments. Like, for instance, if you have arthritis of the shoulder and you've tried injections, you've tried physical therapy, you've tried, modifying your activity, and you've done this for a set period of time, and you're still having pain. Then you think about, surgical procedures like having a shoulder replacement done. Or, if you have a rotator cuff tendon tear, if it's bad to the point where you can't lift your arm despite therapy, then, sometimes you need surgery to fix it. Nowadays we can do a lot of our procedures minimally invasive, meaning, use small instruments and a camera in order to repair tendons and to treat even some low-grade arthritis. Usually it's for people who've tried everything and then they're still having problems with their shoulder.
Yeah, shoulder is such a part of the body. It's used, I think, the most. Your hands are always active, right? So your shoulder intend to, but sometimes we don't realize when we hurt it and we keep going. And I think at one point you get into severe pain. So now can you tell us, what can people do to prevent shoulder injuries, doctor? Because that is, I feel it's at least for a woman, I feel like we cannot live if we have these kind of pains, and we have to do everything in the house and work and so many things we have to engage our hands and shoulder.
Yeah, especially women who are doing a lot of repetitive work. I think in general you have to be very mindful of how much you're using your shoulders or your arms and whatnot, and make sure you take breaks, make sure you do things sensibly. The other thing that's very important, especially when you're above the age of 65, is to get a bone density test from your primary care doctor. That's very important because as we get older, we tend to have more falls, and when you have more falls with low bone density, you can get fractures. And so, it's very important to do preventative measures such as, getting a bone density test and making sure that if you have something like osteoporosis or osteopenia, you get that treated by your primary care doctor. Now, other things you can do is make sure that you're physically fit. Get some exercise. And with exercise, it also includes using weights. And strengthening your muscles and whatnot. Especially as we get older, we lose our bone mass. Our bone mass and our muscle mass. After a certain age, we start to lose this, and in order to preserve that, it's very important to be physically active, get exercise daily, make sure you're physically fit, and oftentimes with these simple measures, along with a good diet and avoiding habits like smoking and such, people can really prevent a lot of the common injuries that we see in our orthopedic practices.
Okay. So it's very important for one to be very active physically and diet-wise. They have to be having a good lifestyle.
Yeah, absolutely. And, make sure you see your primary care doctor, make sure you get that diabetes under control, make sure you get a yearly checkup, and your blood pressure under control. All those simple measures you do can help prevent you from having to see somebody like myself, when you have, a fall or an injury, and then you have a fracture.
Yes, doctor, it's very good information, but I want to ask you, like, say, as you said, blood pressure, diabetes, and, other weights and all that, one has to be fit, but sometimes it's very hard for one individual to have everything balanced, because sometimes your body just react to things, and it's hard for them to bring your blood sugar, blood pressure, and weight to be under control at what is expected. So in that case, how much one person should do where they can balance themselves and still keep going with their daily lifestyle or daily habits and things what they're doing?
Well, you should do whatever you can to benefit your health. If it's just going for a walk a couple of hours a day, or not a couple of minutes a day, sorry, not hours, minutes a day. Or if it's instead of at the end of the night, sitting down and watching TV, if you just get on get on like a stationary bicycle for a couple of minutes, or you just get up and get your heart moving a little bit, or make sure you see your primary care doctor and take your medications that you're supposed to take. Simple measures really go a long way. The other things are like, when you're eating, make sure it's well balanced, not too much, not too heavy on the carbs, and you eat plenty of fruits and vegetables. And, things like that really do help.
So just listen to your body and do your best to change your lifestyle is the main key, I guess, in this matter, right?
Absolutely.
Yeah. So one last tip, doctor, for one general individual, what they should do to prevent shoulder injuries.
Like I said, to prevent shoulder injuries, make sure you try and get some exercise on a day basis. Make sure you eat healthy, and see your doctor. These are all very simple things you can do, and in the long run, it'll go a long way.
All right. Thank you so much, Doctor, for coming on airwaves of EBC Radio. This is Dr. Amish Naik, and he is an orthopedic surgeon. And we were talking on shoulder injuries today, and I would like to give a shout out and thanks to Robert Wood Johnson Barnabas Health for sponsoring this health education series. So, Doctor, thank you again for coming on EBC and educating our listeners, and looking forward to talking to you more.
Thank you very much.